Good morning from Gambia, our esteemed attendees of the Alcohol Review Conference. I am honored to have the opportunity to speak with you today on the theme Advances in Global Efforts to Reduce Alcohol Harms. Next slide, please. Okay. My presentation will focus on the alcohol consumption's prevalence as a global issue. Alcohol is a significant issue worldwide, causing harm on the individuals, families, and communities alike. Millions of people are suffering as a result of NCD, non-communicable disease, and alcohol is one of the risk factors of those NCD. There are strategies that we are provided. One of the key implementation of evidence-based policies interventions. Examples of the SAVER models, the WHO SAVER models, which is a 5-point strategy, aims to reduce alcohol consumption in the world. One is to strengthen restriction on alcohol availability. 2, advance and enforce drink driving countermeasures. 4, 3, facilitate access to treatment and rehabilitation. 4, enforce comprehensive bans on alcohol promotions, sponsorship, and advertising. 5, raise prices through pricing policies. So this is a 5-point strategy that's provided by WHO for countries to adopt in their policies to combat the issue of alcohol. Next slide, please. Also, we are looking at the integrations of the technology solutions and the digital health interventions. These are very, very important. It has revolutionized the way we approach our alcohol harms reductions. From mobile apps that tracks drinking habits, provide personalized feedbacks to online support groups and telehealth services. These are very, very important apps that have really paid dividends on the harm reductions of alcohol use. Significantly impacted alcohol effects to reduce alcohol consumptions by increasing access to information and the support, providing personalized interventions, enabling remote monitoring and the support, improving treatments, outcomes, and informing policy-based decisions. So these are strategies that aims to reduce alcohol consumption in the world. Next slide, please. Because we don't have much time, I have a few recommendations that I can share with you. One of the recommendations is to collaborate with international organizations, governments, and stakeholders to develop and implement effective policies and initiatives to reduce alcohol harm. As I said, one of the strategies that is the SAVER, and also if the WHO also can focus on a framework convention on the alcohol control. This will also put countries on tax to adopt and assign the treaty that will help to reduce alcohol consumption in the world. 2, implement comprehensive prevention programs targeting at risk populations, including youth, pregnant women, and individuals with substance use disorder. So this is very, very important because, as we know, looking at the prevalence of alcohol use in most countries, my example of my own country in the Gambia is 2.6% per capita, which is very, very alarming. As we all know, in public health, above 3% is very, very alarming. So in the Gambia is 2.6, that's the prevalence. And when you look at the multi-sectoral action plans, 34% of all deaths as a result of NCD, non-communicable diseases. So it is a cause for alarm. Thirdly, we also need to strengthen enforcement on existing laws. As I said, most countries have policies, they have laws. So this will also help in combating the issue of alcohol use. Promote evidence-based interventions and the brief interventions. Treatment services, as I said, we need rehabilitation centers because there are addictions and addictions we need to support them. And how do we support them? We need to get a rehab center, a treatment center to support the people that are affected. The 5th one is to advocate for increased funding and resources to support digital efforts to reduce alcohol harm, including research, prevention, and treatment initiatives. This is very important because, as we all know, the players in the alcohol industry, in terms of funding, is very limited. So we need more funding so that we can have more research to support research to have more evidence base. So on that note, I thank you very much for your kind attention, and I will sincerely appreciate and thank the president of ICRA, that is International Confederation of Alcohol, Tobacco, Modern Side Committee, my boss Andy. Thank you so much. Our governor, Ahmed Zion Baba, the Association of African Mental Health Reform. Thank you for the coordination, WAPA Secretariat, as West African Alcohol Policy. We thank you for the wonderful job that you are doing in West Africa. I thank you all.